In the world of diabetes medications, two drugs stand out: Pioglitazone and Rosiglitazone. Both are members of the thiazolidinedione class and are used to improve insulin sensitivity in patients with type 2 diabetes. However, despite their similarities, there are key differences between these two medications that make them distinct choices for patients. Pioglitazone, commonly known by the brand name Actos, works by reducing insulin resistance and increasing glucose utilization in the body. It has been shown to improve glycemic control and lower HbA1c levels. On the other hand, Rosiglitazone, also known as Avandia, works in a similar manner but is more selective in its mechanism of action. When it comes to side effects, both medications have potential risks. Pioglitazone has been associated with weight gain and fluid retention, while Rosiglitazone has a higher risk of causing cardiovascular events. In this video, we will delve into a detailed comparison of Pioglitazone and Rosiglitazone, looking at their mechanisms of action, effectiveness in improving insulin sensitivity, side effects, and overall safety profiles. By examining the differences between these two drugs, we hope to provide valuable insights for healthcare professionals and patients alike, allowing them to make informed decisions about their diabetes management. Mechanisms of action. Pioglitazone and Rosiglitazone both belong to the thiazolidinedione class of drugs, which work by activating peroxisome proliferator activated receptors, PPARs, in the body. PPARs are nuclear receptors that play a crucial role in regulating glucose and lipid metabolism. By activating PPARs, both medications increase insulin sensitivity and improve glucose utilization. However, there is a slight difference in their mechanism of action. Pioglitazone activates both PPAR alpha and PPAR gamma receptors, while Rosiglitazone is more selective in its activation of PPAR gamma. PPAR gamma activation leads to increased insulin sensitivity in adipose tissue, skeletal muscle, and liver cells, resulting in improved glycemic control. Efficacy in improving insulin sensitivity. Both Pioglitazone and Rosiglitazone have been shown to be effective in improving insulin sensitivity in patients with type 2 diabetes. Multiple clinical trials have demonstrated their ability to reduce HbA1c levels and improve glycemic control. A study published in the New England Journal of Medicine compared the efficacy of Pioglitazone and Rosiglitazone in a randomized controlled trial involving 2,368 patients with type 2 diabetes. The results showed that both medications significantly reduced HbA1c levels, with no statistically significant difference between the two groups. However, Pioglitazone was associated with a greater reduction in fasting plasma glucose levels compared to Rosiglitazone. Another study published in Diabetes Care compared the effects of Pioglitazone and Rosiglitazone on insulin sensitivity in obese patients with prediabetes or early type 2 diabetes. The results showed that both medications improved insulin sensitivity, but Pioglitazone was associated with a greater improvement compared to Rosiglitazone. Overall, both Pioglitazone and Rosiglitazone have demonstrated efficacy in improving insulin sensitivity, but there may be slight differences in their effects on glucose control and fasting plasma glucose levels. Side effects and safety profile. Like all medications, Pioglitazone and Rosiglitazone have potential side effects and safety concerns. It is important for healthcare professionals and patients to be aware of these risks when considering these medications for diabetes management. Pioglitazone has been associated with weight gain and fluid retention. Some patients may experience edema, swelling, in the lower extremities, which can be managed with diuretics if necessary. Additionally, Pioglitazone has been associated with an increased risk of bone fractures, particularly in women. It is important to monitor bone health and consider alternatives if there are concerns about fracture risk. On the other hand, Rosiglitazone has been associated with a higher risk of cardiovascular events, such as heart attack and stroke. In 2010, the U.S. Food and Drug Administration, FDA, restricted the use of Rosiglitazone due to safety concerns. It is important to carefully assess cardiovascular risk factors in patients considering Rosiglitazone and consider alternative medications if there are significant cardiovascular risks. It is important to note that both medications have potential risks, and the decision to use Pioglitazone or Rosiglitazone should be made on an individual basis, taking into account the patient's specific needs and risk factors. Drug interactions and contraindications. Both Pioglitazone and Rosiglitazone can interact with other medications and have contraindications that should be considered when prescribing these drugs. Pioglitazone is metabolized by the liver, mainly through the cytochrome P450 enzyme system. Therefore, medications that inhibit or induce these enzymes can affect the metabolism of pioglitazone. For example, strong CYP2C8 inhibitors, such as gemfibrozil, can increase pioglitazone levels and should be used with caution. Similarly, strong CYP2C8 inducers, such as rifampin, can decrease pioglitazone levels and may require dose adjustments. Rosiglitazone also undergoes metabolism through the cytochrome P450 enzyme system, primarily via CYP2C8 and CYP2C9. Therefore, drug interactions can occur with medications that affect these enzymes. For example, fluconazole, a strong CYP2C9 inhibitor, can increase rosiglitazone levels and may require dose adjustments. Both medications have contraindications in patients with severe heart failure or a history of bladder cancer. It is important to carefully evaluate patients for these contraindications before prescribing pioglitazone or rosiglitazone. Comparison of clinical trials and studies. Several clinical trials and studies have compared the efficacy and safety of pioglitazone and rosiglitazone in patients with type 2 diabetes. A meta-analysis published in the Journal of Diabetes and Its Complications compared the cardiovascular safety of pioglitazone and rosiglitazone. The results showed that pioglitazone was associated with a lower risk of cardiovascular events compared to rosiglitazone. However, it is important to note that this meta-analysis included studies conducted before the restrictions on rosiglitazone use were implemented. Another study published in Diabetes, Obesity and Metabolism compared the effects of pioglitazone and rosiglitazone on liver function in patients with non-alcoholic fatty liver disease, NAFLD. The results showed that both medications improved liver enzymes and markers of liver inflammation, with no significant difference between the two groups. Overall, the available clinical trials and studies suggest that both pioglitazone and rosiglitazone are effective in improving insulin sensitivity and glycemic control. However, pioglitazone may have a more favorable cardiovascular safety profile compared to rosiglitazone. Recommendations and guidelines for use. The American Diabetes Association, ADA, and the European Association for the Study of Diabetes, EASD, provide recommendations and guidelines for the use of diabetes medications, including pioglitazone and rosiglitazone. According to the ADA-EASD guidelines, pioglitazone may be considered as a treatment option in patients with type 2 diabetes who have not achieved glycemic control with other oral medications or who have contraindications or intolerance to other agents. It is important to consider the potential risks and benefits of pioglitazone in each individual patient. As for rosiglitazone, the ADA-EASD guidelines recommend caution in its use due to the cardiovascular safety concerns associated with this medication. It is generally not recommended as a first-line treatment option and should be considered only after careful assessment of cardiovascular risks and alternative treatment options. Cost and availability. The cost and availability of pioglitazone and rosiglitazone may vary depending on the country and healthcare system. In general, pioglitazone is available as a generic medication, which may make it more affordable compared to brand-name versions. Rosiglitazone, on the other hand, may have more limited availability due to the restrictions imposed by regulatory agencies. It is important for patients to discuss the cost and availability of these medications with their healthcare providers and consider any insurance coverage or assistance programs that may be available. Patient considerations and preferences. When choosing between pioglitazone and rosiglitazone, it is important to consider the individual patient's preferences and specific needs. Factors such as potential side effects, cardiovascular risks, drug interactions, and cost should be taken into account. Some patients may prefer pioglitazone due to its lower cardiovascular risk profile and potential benefits on bone health. Others may have concerns about weight gain and fluid retention associated with pioglitazone and may prefer rosiglitazone despite its cardiovascular risks. It is important to have an open and honest discussion with patients, addressing their concerns and preferences, to make an informed decision about the best medication for their diabetes management. Conclusion: choosing the right medication for insulin sensitivity. Pioglitazone and rosiglitazone are both valuable options for improving insulin sensitivity in patients with type 2 diabetes. They belong to the thiazolidinedione class of medications and work by activating PPARs to increase insulin sensitivity and improve glycemic control. While both medications have demonstrated efficacy in improving insulin sensitivity, there are important differences to consider. Pioglitazone has a more favorable cardiovascular safety profile but is associated with weight gain and fluid retention. Rosiglitazone has a higher risk of cardiovascular events and may require more careful patient selection. Ultimately, The choice between pioglitazone and rosiglitazone should be based on individual patient considerations, including potential side effects, drug interactions, contraindications, and patient preferences. Healthcare professionals should closely monitor patients using these medications and regularly reassess their treatment plans to ensure optimal diabetes management. By understanding the mechanisms of action, efficacy, side effects, and safety profiles of pioglitazone and rosiglitazone, healthcare professionals and patients can make informed decisions about the best medication for insulin sensitivity in the management of type 2 diabetes.